morning. I'm Greg Lockhow with the Blue Island Chamber of Commerce, and we're here on Channel 4 TV in Blue Island. This is another edition of House Call, where we visit Metro South Medical Center and bring you some up-to-date information on medical technology. Today our special guest is Doctor Amjad Safvi, who is an interventional radiologist. And we're going to learn today about how diagnosis and treatment help patients. So what are some of the common things that you encounter in your work?
Well, Greg, we encounter all different kinds of problems and diseases. We treat almost any patient that comes in the hospital that needs our help. We cover diseases from head to toe. We cover all organ systems, including vascular, as well as liver, kidneys, stomach, anything that needs to be treated. We're often considered the doctor's doctors, but we also treat patients directly. The doctors, if they have a complicated situation that they can't deal with, especially the surgeons or primary care doctors who need additional services from us, we treat those in a minimally invasive way, much safer for the patient and less painful for the patient.
And less time spent in the hospital, I would imagine.
Yes, absolutely, because it's less invasive, it's faster patient stay in the hospital because they don't have to recover as much. And we are sometimes the only specialty that can help the patients because other doctors are not able to do the procedures that we can do sometimes.
So today we're going to talk about peripheral arterial disease, is it vein thrombosis or
deep vein thrombosis?
And some of the other symptoms such as pain or swelling in the legs.
That's right. These are all the different types of diseases that we treat. The deep vein thrombosis is clotting in the legs. We offer treatments for that condition here.
Dr. Safvi, let me ask you about deep vein thrombosis. First of all, I have no idea what it is, so can you tell us?
Yeah, this is the deep veins. You have the deep veins that can clot off. So oftentimes...
What's meant by a deep vein?
These are the larger veins in your body that drain the blood from your legs or your arms. Mm-hmm. Those are called the deeper veins. You do have the superficial veins, but the deeper veins can give you trouble if they become thrombosed, which is clotting. And so if they clot off and you get blood clots there, it's a pretty serious situation.
So the flow is restricted?
Right. The flow is not only restricted, but you're risking that clot can move up to your lungs and can in rare circumstances, can cause death. So it's a very serious.
Do they come from that?
The strokes are also clot moving into the brain, except it's through the arteries.
Oh.
Okay, so that's actually also a different. It's the arterial side of the circulation where the strokes are caused by clots going from the heart to the brain.
So what does your department do to combat that?
Right, so the deep vein thrombosis is treated with first line of defense is thinning the blood, anticoagulation medicine like Coumadin. And then once you're diagnosed with deep vein thrombosis, it can actually result in quite a severe vein problem for you long term if you don't get it treated right away. Now, with this day and age, you have the ability to treat and get rid of the clots within a few hours. Mm-hmm. You can take a catheter up into the vein under this machine's guidance and put some dye there, and you can, it's like a mechanical moving catheter. It shreds or obliterates that clot into small pieces. So your body will reabsorb that. Mm-hmm. So that is a very exciting treatment that's available to patients who suffer from deep vein thrombosis. First of all, the symptoms would be that the patient is suffering leg pain and their leg is swelling up. They would eventually come to the emergency room or go to see their doctor. They would eventually then get an ultrasound and they would diagnose that condition and then eventually be referred to here for treatment of that.
Is that related to diabetes at all, or is that completely separate?
Diabetics can be affected with the deep vein thrombosis because they're less mobile. People who can't walk as much are affected by this condition. It's a fairly across-the-board condition. It's sort of hard to predict who will get it, but if you do get it, then you should get it treated right away.
Okay, we have a volunteer victim, Anne, who is going to help us demonstrate this equipment. So, what's the machine that she's on, Dr. Safvi?
This is a fancy C-arm. It's an X-ray machine. that helps us look into the body as we do some procedures on the patient. It lets us angle the machine one way or the other. I'll demonstrate that in a little bit. What Anne has right now is some leads on her wrists and chest. We monitor her vital signs on the bottom left corner.
So she is alive.
She is, her heart is alive, yes.
That's a good sign.
Yes, and what we can do on this table is we can go into the arterial system or the venous system, or even go into her brain with some catheters and wires and take a look. So, for example, if she had some pain in her legs, God forbid, if she has some peripheral arterial disease, we would poke a needle right at the groin and go in with until we get some blood back and put a wire up, and we would be able to see that with the x-ray, and then guide that wire and catheter down the leg. Like we would go in from this side, go down to the leg. We could almost go to her foot if you wanted to. Mm-hmm. And we would just move the machine in the area of interest. So Chris here is going to help us move the machine over, and